Hello everyone, welcome back to my channel. It's me, Yeonni, and for this week's mental health video, I wanted to share a video on an introduction to the personality disorders in the DSM-IV. According to the DSM-IV, there are 10 personality disorders in 3 different clusters, cluster A, B, and C, and in today's video I wanted to talk a little bit about personality disorders in general, share some definitions on what each of these personality disorders are, share some research out there regarding different types of treatments for these personality disorders, and a conversation about stigma. So if you are interested in any of these topics, just keep watching and let's just get straight into the video. So according to the DSM-IV, which is pretty much like the Bible of mental illness and psychological disorders, there are 10 different kinds of personality disorders. The way that one could be diagnosed with the personality disorders is that if there are significant impairments in self and interpersonal functioning together with one or more pathological personality traits. So putting that into more easier terms, I think in a way that I could also better understand is that basically those who may be diagnosed with personality disorders have had a long history of patterns of behavior that are not quote-unquote normal in society, where it could lead to a lot of distress and problems in one's own functioning in living in a society because of the way that they view themselves or the way that they view themselves in a relationship with someone else. When one has a personality disorder, at least 2 of these following areas must be affected: way of thinking about oneself and others, way of responding to other people, way of relating to other people, and way of controlling one's behaviors. So at least 2 of these areas can be affected for someone to be diagnosed with a personality disorder. So before going into more depth and definitions of each of these personality disorders, it is important to note that the way that these personality disorders were kind of defined and put into these clusters, it's more of a result of a historical evaluation through observation as opposed to scientific studies. So they can be rather vague and kind of loosely constructed, which pretty much means that it's very hard to find any individual who will perfectly fit into a symptom set for like one specific type of personality disorder, which means most of the time when a mental health professional is in a place where they need to diagnose or treat someone who may have a personality disorder, if someone has, for example, paranoid personality disorder, they may exhibit symptoms that could be both paranoid or like schizoid or schizotypal. So usually it stays within one cluster. However, the symptoms could kind of overlap between different personality disorders in each cluster. So the division into the 3 clusters are supposed to kind of reflect the way that these 3 are very different, but amongst each cluster there could be a bit overlap. Another thing to note is that the majority of individuals who may have personality disorders don't really come into contact with mental health professionals, whether through their own will or because they may not know that they have a personality disorder. So the instances where they do come across mental health professionals to be diagnosed with something or to receive help can be mostly if they have a different kind of mental health disorder, and through evaluation it can be assessed that there may be a personality disorder in place, or in times of crises, or if one has harmed him or herself or has broken the law essentially. So moving into a deeper dive into each of the clusters, we can now start talking about cluster A, which is the odd, bizarre, and eccentric cluster. So the first personality disorder in this cluster, and this is in no particular order, it just happens to be what I wrote my notes in, is the paranoid personality disorder. Those who may be diagnosed with paranoid personality disorders may have patterns of being suspicious of others and seeing them as mean or spiteful. They may often assume people will harm or deceive them and don't confide in others or become close to them. The next one is schizoid personality disorder. Those who may be diagnosed with schizoid personality disorder may find themselves being detached from social relationships and expressing little emotion. Most of the times they do not seek close relationships, choose to be alone, and seem to not care about praise or criticism to others. And the last one of cluster A is the schizotypal personality disorder. Those with schizotypal personality disorder may exhibit patterns of being very uncomfortable in close relationships, having distorted thinking and eccentric behavior, and may have odd beliefs or odd or peculiar behavior or speech and may also have excessive social anxiety. So as you can see, a lot of those symptoms may exhibit maybe moments that you've had while living your life. Like for example, we can find ourselves being paranoid here and there. We can find ourselves like the paranoid personality disorder. We can find ourselves feeling detached from social relationships at times, like the schizoid personality disorder, or we could even find ourselves being very uncomfortable in close relationships or having distorted thinking or eccentric behavior, whatever that means. So as you can see, when it comes to personality disorders, there are a lot of schools of thought and research on what is legitimate and what isn't, but what really sets apart someone who may be experiencing some of these symptoms here and there versus someone who could be diagnosed with these personality disorders is that the individuals who are diagnosed have experienced severe distress and severe impairments in their lives and their goals, and these symptoms get in the way of them wanting to achieve their goals in life, whatever it may be. Cluster B personality disorders can be described as being dramatic or erratic. The first personality disorder in this cluster is the antisocial personality disorder. The antisocial personality disorder, people who may have this disorder may show patterns of disregarding or violating the rights of others, may not conform to social norms, may repeatedly lie or deceive others, or may act impulsively. We recently saw a surge of commentary on antisocial personality disorder because of Shane Dawson's documentary on Jake Paul and like his sociopathic tendencies. So sociopaths or psychopaths may have a diagnosis of antisocial personality disorder. The next personality disorder is the borderline personality disorder. Those who have this disorder may show patterns of instability in personal relationships, intense emotions, poor self-image, and impulsivity. They may go to great lengths to avoid being abandoned, and they may show repeated suicide attempts, display inappropriate intense anger, or have ongoing feelings of emptiness. This causes a lot of emotional, behavioral, interpersonal, cognitive, and identity symptoms within the individual, and those with BPD are characterized by hypersensitive emotions, intense emotional reactivity, and a slow return to baseline, whatever that may be. There's a lot of symptoms of splitting, which is going back and forth from extreme shifts between positive and negative thought patterns, because those who have borderline personality disorders have shown that a lot of the times the big picture of whatever the situation is not really on their mind. They tend to focus a lot more on the present and the now and their feelings at the time instead of seeing the big picture. And the third personality disorder is the histrionic personality disorder. Those who may be diagnosed with this disorder may show patterns of excessive emotion and attention seeking. They may be uncomfortable when they are not the center of attention, may use physical appearance to draw attention to themselves, or have rapidly shifting or exaggerated emotions. And lastly, for this cluster is the narcissistic personality disorder, a pattern of need for admiration and a lack of empathy for others. They may have a grandiose sense of self-importance, a sense of entitlement, taking advantage of others. And finally, the cluster C personality disorders are the ones that exhibit symptoms that are more anxious and fearful. The first one is the avoidant personality disorder. Those with this disorder may show patterns of extreme shyness, feelings of inadequacy, and being extremely sensitive to criticism, may be unwilling to get involved with people unless they are certain of being liked, be preoccupied with being criticized or rejected, or may view themselves as not being good enough or socially inept. The second one is the dependent personality disorder. Those with this disorder may show a pattern of needing to be taken care of and show submissive and clingy behavior. They may have difficulty making daily decisions without reassurance from others, and may feel uncomfortable or helpless when alone because of fear of inability to take care of themselves. And lastly, the last personality disorder of cluster C is the obsessive-compulsive personality disorder. Those with this disorder may show a pattern of preoccupation with orderliness, perfection, and control, may be overly focused on details or schedules, may work excessively, not allowing time for leisure or friends, or may be inflexible in their morality and values. And once again, it is not the same as OCD. OCPD reflects more on the person and the personality as opposed to their actions, like OCD does. So next part of the video is the treatment of personality disorders. As you can see, these are lots of different personality disorders that encompass a lot of different types of symptoms in people in different places of their thoughts and feelings when it comes to the way they get through life. And as with any other mental illnesses, different types of treatment can help different types of personality disorders. It has shown that certain type of psychotherapy can be beneficial for those who have personality disorders. Psychotherapy is essentially what I also do at work, which is a lot of client-centered talk therapy, where the person is given the safe room and a place to gain knowledge and insight more about their personality disorder and can think and talk about their thoughts, feelings, and behaviors, how the world looks and feels to them versus how it looks and feels like for other people, and where that divide is, how they can bridge the divide if that's what they want. They can learn to manage symptoms and develop coping skills with different types of distress that they can experience due to having a personality disorder. And once again, it really depends on the specific personality disorder, how severe it is, and the individual's circumstances. Psychoeducation, teaching individuals about personality disorders and what they're going through. And when it comes to medication, there's no specific medication that can be prescribed to treat those who have personality disorders. However, medication like antidepressants or anti-anxiety medication or mood stabilizers can help to treat the symptoms of these personality disorders and reduce the distress that people may have dealing with the symptoms. Last but not least, when it comes to personality disorders, there's still a lot of this air of curiosity, of not really knowing, a lot of negative stigma really when it comes to personality disorders, because pretty much of what is portrayed in the media, but also a lack of knowledge and awareness that these personality disorders exist and are real and people are suffering because of them. I mean, a lot of stigma also exists in the mental health field when it comes to treating personality disorders. A lot of clinicians, whether it's because of their own biases or because of a lack of knowledge, can hold internalized negative stigma regarding treating those who have personality disorders, which can lead to misdiagnosis and treatment that isn't really even helping people. For example, disorders like borderline personality disorder or BPD, which I'll say from now on, those who have that disorder can exhibit symptoms of being dramatic, manipulative, and even attention-seeking at times, which can cause even therapists and other clinicians in the field to not take these people's symptoms seriously. And this could all negatively affect their treatment. If a clinician is not willing to treat someone who is struggling with a mental illness, whether it's anxiety or depression, or in this case a personality disorder, if someone who is in the helping field is refusing to help that individual to the best way that they can because of the symptoms of that illness, it can lead to a lot of treatment rejection, which leads to exhaustion on both ends of the helper and the one who needs help. And at the end, this whole group of people who are suffering from mental illnesses can become rejected from treatment overall. A lot of patients who have BPD, according to research, are even turned away from treatment a lot of the times because of the way that their symptoms are exhibited and how it could potentially get in the way of treatment. But research has shown that at least 80% of those who have BPD can manage symptoms with proper treatment. So if we are able to get past that barrier of stigma as clinicians and even as society and offer treatment to those with personality disorders just the way we would to anyone else with any kind of mental health illnesses, there is evidence of these people being able to get better and live normal lives that where they can achieve their goals, where they won't be inhibited and they can live normal lives and pursue goals that they want. I know this video was super dense and condensed, but for the sake of time, this is all I can do in one video. If you would like more specific videos on each of the personality disorders, I know I already have one on antisocial personality disorder. I'll pop it up right here. I made this one a few months ago. I can do more of them. Please leave it down in the comments down below. It would be awesome. I would love to make more videos on personality disorders because we really need more awareness, more knowledge, more information out there to, combat the stigma and really just show these people who may be struggling with these illnesses that they are seen, that their illness is valid, and there is hope out there. So please like this video if you liked it, and please subscribe to my channel. I make mental health videos, social justice, social work videos, and whatever other kinds of videos I do feel like making at that time. So if you want to check it out, then just check out my channel to see which kinds of videos I do make. That was a lot of terms today. I'm like exhausted from the video, but it was definitely worth it, and I wanted to make this video for the longest time, so I'm really glad I did. Anyway, I hope you have an absolutely wonderful day, and I'll see you in the next one. Bye!